Free therapy. Introduction. Mental health is an essential aspect of overall well-being, yet access to mental health services remains a significant challenge for many people around the world. Therapy, a crucial component of mental health care, can be prohibitively expensive, leaving many individuals without the support they need. In response to this, a growing movement towards free therapy has emerged, offering individuals a range of options to access mental health care without the financial burden. This movement encompasses various forms of therapy, from traditional face-to-face sessions to innovative online platforms, community-based programs, and peer support networks. Free therapy provides a lifeline to those who might otherwise be unable to access mental health care. It addresses the disparities in mental health services, ensuring that everyone, regardless of their financial situation, has the opportunity to receive the support they need. This piece delves into the different avenues through which free therapy is made available, the challenges and benefits associated with these services, and the impact of free therapy on individuals and communities. The importance of mental health care. Mental health is an integral part of overall health, influencing how we think, feel, and act in our daily lives. It affects our ability to cope with stress, relate to others, and make decisions. Mental health issues, such as depression, anxiety, and stress-related disorders, are common and can significantly impair an individual's quality of life. Access to mental health care is crucial for managing and improving mental health. Therapy, in particular, is an effective way to address mental health issues, offering individuals the tools and strategies needed to navigate their challenges. However, therapy can be expensive, with costs ranging from $60 to $200 per session, depending on the therapist's qualifications and location. For many, these costs are unaffordable, leading to untreated mental health conditions that can worsen over time. The growing need for accessible therapy. The demand for mental health services has increased dramatically in recent years, driven by a combination of factors, including rising awareness of mental health issues, the stress of modern life, and the impact of global events such as the COVID-19 pandemic. As more people seek therapy, the gap between those who need mental health care and those who can afford it has widened. This growing need has spurred the development of free therapy programs, which aim to bridge this gap by offering accessible mental health services to all. These programs are designed to provide support to individuals who might otherwise go without therapy due to financial constraints. They range from traditional therapy models to more innovative approaches that leverage technology and community resources. Types of free therapy. 1. Community-based therapy programs. Community-based therapy programs are often offered by non-profit organizations, local governments, and community health centers. These programs provide free or low-cost therapy to individuals in need, often focusing on specific populations such as low-income individuals, veterans, or those with chronic mental health conditions. These programs typically offer a range of services, including individual and group therapy, crisis intervention, and support groups. They may also provide additional resources such as housing assistance, job training, and case management to help address the broader social determinants of mental health. 2. Online therapy platforms. The rise of digital technology has led to the development of online therapy platforms, which offer a convenient and often more affordable alternative to traditional therapy. Many of these platforms provide free or low-cost therapy options, making mental health care more accessible to those who might not be able to attend in-person sessions. Online therapy platforms typically connect users with licensed therapists through video calls, phone calls, or messaging. Some platforms offer entirely free services, while others operate on a sliding scale or provide financial assistance to those who qualify. Additionally, many platforms offer self-guided therapy resources, such as workbooks, videos, and mindfulness exercises, which can be accessed for free. 3. Peer support networks. Peer support networks provide an alternative form of therapy that leverages the power of shared experiences. These networks connect individuals who are facing similar mental health challenges, allowing them to support each other through shared experiences, advice, and empathy. Peer support can be particularly beneficial for those who may not feel comfortable seeking traditional therapy or who want to supplement their therapy with additional support. Many peer support networks are free to join and are facilitated by trained peer counselors who have lived experience with mental health issues. 4. University counseling services. Many universities and colleges offer free or low-cost counseling services to students. These services are typically provided by licensed counselors, psychologists, or supervised trainees, and they offer a range of mental health services, including individual therapy, group therapy, and crisis intervention. University counseling services are a valuable resource for students who may be struggling with mental health issues while also facing the financial constraints of college life. These services are often included in the cost of tuition, making them accessible to all students. Challenges in providing free therapy. While the availability of free therapy is a significant step forward in addressing mental health disparities, there are several challenges associated with providing these services. One of the primary challenges is funding. Free therapy programs rely heavily on funding from government grants, donations, and volunteer efforts. Securing consistent and adequate funding can be difficult, leading to limited availability of services and long wait times for therapy. Another challenge is the stigma associated with seeking free therapy. Some individuals may feel that free therapy is of lower quality than paid services or that it is only for those who are truly in need. This stigma can deter individuals from seeking help, even when free therapy is available to them. Quality of care is another concern. While many free therapy programs are staffed by licensed and experienced professionals, others may rely on volunteers or trainees who may not have the same level of expertise. Ensuring that all individuals receive high-quality care is a crucial aspect of any free therapy program. The benefits of free therapy. Despite the challenges, free therapy offers numerous benefits, both for individuals and society as a whole. By removing financial barriers, free therapy ensures that more people have access to mental health care, which can lead to better outcomes for individuals and communities. 1. Increased accessibility. One of the most significant benefits of free therapy is the increased accessibility it provides. Financial constraints are one of the primary reasons people do not seek mental health care, and by eliminating or reducing the cost, free therapy makes it possible for more people to get the help they need. This increased accessibility can lead to earlier intervention, which is crucial in preventing mental health issues from escalating into more severe conditions. 2. Reduce stigma. Free therapy programs can also help reduce the stigma associated with seeking mental health care. By making therapy more common and accessible, these programs normalize the idea of getting help for mental health issues. As more people openly access and talk about therapy, the stigma surrounding mental health care can diminish, encouraging even more individuals to seek help. 3. Community support and empowerment. Many free therapy programs are rooted in the community, fostering a sense of support and empowerment among participants. Community-based programs often focus on building connections and resilience, helping individuals feel less isolated and more supported in their mental health journeys. This sense of community can be particularly beneficial for marginalized populations who may feel disconnected from traditional mental health services. 4. Prevention and early intervention. Free therapy programs play a critical role in prevention and early intervention. By providing accessible mental health care, these programs can help individuals address issues before they become more severe. Early intervention can prevent the development of chronic mental health conditions, reduce the need for more intensive treatments, and improve long-term outcomes for individuals. 5. Improved overall health. Mental health is closely linked to physical health, and by improving access to mental health care, free therapy can also contribute to better overall health outcomes. Untreated mental health conditions can lead to physical health problems such as chronic pain, heart disease, and weakened immune function. By addressing mental health issues, free therapy can help individuals maintain better physical health as well. 6. Economic benefits. Investing in free therapy can also have economic benefits. Mental health issues are a significant cause of lost productivity, absenteeism, and disability. By providing accessible mental health care, free therapy can help individuals remain productive and engaged in their work and daily lives. Additionally, early intervention and treatment can reduce the need for more expensive treatments down the line, potentially saving money for both individuals and the healthcare system. Case studies: successful free therapy programs. To better understand the impact of free therapy, it's helpful to look at specific programs that have successfully provided free mental health care to those in need. Below are examples of successful free therapy programs from around the world. 1. The MindSpot Clinic, Australia. The MindSpot Clinic is a free, national online mental health clinic in Australia that provides assessment and treatment for adults experiencing anxiety, depression, and other mental health conditions. The clinic offers online courses and therapist-guided treatments, all of which are free of charge to Australian residents. Since its launch, the MindSpot Clinic has provided services to thousands of individuals, demonstrating the potential of online platforms to offer accessible and effective mental health care. 2. Crisis Text Line, United States. Crisis Text Line is a free, 24/7 support service that connects individuals in crisis with trained crisis counselors via text message. The service is available in the United States, Canada, the UK, and Ireland. Crisis Text Line provides immediate support to individuals experiencing a mental health crisis, helping them navigate their emotions and connect with additional resources if needed. The service has been widely praised for its accessibility and effectiveness in providing immediate mental health support. 3. The Samaritans, United Kingdom. The Samaritans is a UK-based charity that provides free, confidential support to individuals experiencing emotional distress or suicidal thoughts. The organization operates a 24/7 helpline staffed by trained volunteers who offer a listening ear to those in need. The Samaritans also offer email and face-to-face support at various locations across the UK. The organization's long-standing commitment to providing free support has made it a vital resource for countless individuals over the years. For Friendship Bench, Zimbabwe. The Friendship Bench is an innovative mental health program in Zimbabwe that provides free, community-based therapy to individuals with depression and anxiety. The program utilizes trained grandmothers who offer cognitive behavioral therapy on benches in local communities. The Friendship Bench has been shown to significantly reduce symptoms of depression and anxiety, and its success has led to its expansion to other countries in Africa and beyond. The role of technology in free therapy. Technology has played a transformative role in making therapy more accessible, particularly for those who may not have access to traditional face-to-face therapy due to financial, geographical, or other barriers. The following are some of the ways technology is shaping the landscape of free therapy. 1. Online therapy platforms. As mentioned earlier, online therapy platforms have become increasingly popular, offering a convenient and often more affordable alternative to traditional therapy. Some of these platforms provide free services, either through completely free models or by offering a certain number of free sessions. Platforms such as 7cups, iPrevail, and BetterHelp, with financial assistance, are examples of services that have made mental health care more accessible through technology. 2. Mental health apps. A growing number of mental health apps provide users with tools to manage their mental health independently. These apps offer features such as mood tracking, guided meditation, cognitive behavioral therapy, CBT, exercises, and more. While not a replacement for traditional therapy, these apps can be valuable resources for individuals who need additional support. Many mental health apps offer free versions or free resources, making them accessible to a wide audience. 3. Telehealth services. Telehealth services have expanded rapidly in recent years, particularly in response to the COVID-19 pandemic. These services allow individuals to connect with licensed therapists via video calls, phone calls, or messaging, providing a more flexible and accessible way to receive therapy. Many telehealth providers offer free or low-cost options, especially for those who are uninsured or underinsured. 4. Peer support platforms. Online peer support platforms have also gained popularity as a form of free therapy. These platforms connect individuals with similar experiences, allowing them to offer and receive support in a safe, anonymous environment. Examples of peer support platforms include Reddit's mental health communities, 7cups peer support forums, and various Facebook support groups. 5. AI-powered mental health tools. Artificial intelligence, AI, is being used to develop mental health tools that can provide support to individuals in need. For example, AI chatbots such as Wobot and Wysa offer users a way to engage in conversations about their mental health, providing CBT exercises, mood tracking, and coping strategies. While these tools are not a substitute for human therapy, they can offer immediate support and guidance, particularly for those who may not have access to other resources. Challenges of technology-driven free therapy. While technology has expanded access to therapy, it also presents challenges that need to be addressed to ensure that these services are effective and safe. 1. Quality of care. One of the primary concerns with technology-driven therapy is the quality of care. While many online platforms and apps are staffed by licensed professionals, others may not have the same level of oversight or regulation. Ensuring that users receive high-quality care is essential, particularly when dealing with complex mental health issues. 2. Privacy and security. Privacy and security are significant concerns when it comes to online therapy. Users need to be confident that their personal information and conversations are secure and that their privacy is protected. Online platforms must adhere to strict data protection regulations and implement robust security measures to safeguard users' information. 3. Digital divide. The digital divide is another challenge in providing free therapy through technology. Not everyone has access to the necessary devices or internet connection to utilize online therapy services. This divide can exacerbate existing disparities in access to mental health care, particularly for low-income individuals or those living in rural areas. 4. Over-reliance on technology. While technology can be a valuable tool in providing therapy, there is a risk of over-reliance on digital solutions at the expense of face-to-face interactions. For some individuals, in-person therapy may be more effective, and it's important to ensure that technology is used as a complement to, rather than a replacement for, traditional therapy. I can continue from here and build up the remaining sections. Let me know if you'd like to explore specific aspects or continue with more content. The role of government and non-profit organizations in providing free therapy. Government agencies and non-profit organizations play a critical role in expanding access to free therapy services. These entities often step in to fill the gaps left by the private sector, ensuring that vulnerable populations have access to the mental health care they need. Below are key ways in which governments and nonprofits contribute to the availability of free therapy. 1. Government-funded mental health programs. Many governments fund mental health programs that provide free or low-cost therapy to citizens. These programs are often targeted at specific populations, such as low-income individuals, veterans, or those with severe mental health conditions. For example, in the United States, Medicaid offers mental health services to eligible low-income individuals, while the Department of Veterans Affairs provides free therapy to veterans. Government-funded programs can vary widely in their scope and effectiveness, depending on the resources available and the political will to prioritize mental health. However, these programs are essential for providing a safety net for individuals who might not be able to afford therapy otherwise. 2. Non-profit mental health organizations. Non-profit organizations are another vital source of free therapy services. These organizations often focus on specific populations or issues, such as LGBTQ+ individuals, survivors of trauma, or those with chronic mental health conditions. Nonprofits like the National Alliance on Mental Illness, NAMI, the Trevor Project, and the Mental Health Foundation provide a range of free services, including therapy, crisis intervention, and support groups. Nonprofits are often able to provide these services through a combination of donations, grants, and volunteer efforts. Many nonprofit organizations also advocate for mental health policy changes and work to reduce the stigma associated with mental illness. 3. Community mental health centers. Community mental health centers are often funded by a combination of government grants and nonprofit contributions. These centers provide a wide range of mental health services, including therapy, case management, and crisis intervention. They are usually located in underserved areas and are designed to be accessible to all, regardless of income or insurance status. Community mental health centers play a crucial role in providing free therapy to individuals who might not have access to other forms of mental health care. These centers often employ a multidisciplinary team of professionals, including therapists, social workers, and psychiatrists, to provide comprehensive care. 4. Public health campaigns. Government and nonprofit organizations also contribute to the availability of free therapy through public health campaigns. These campaigns aim to raise awareness of mental health issues and promote the availability of free or low-cost therapy services. For example, campaigns like Heads Together in the UK or Mental Health Awareness Month in the US help to reduce stigma and encourage individuals to seek help. Public health campaigns often partner with media outlets, schools, and community organizations to reach a broad audience. By normalizing the conversation around mental health and promoting the availability of free services, these campaigns help to increase access to therapy. Innovative approaches to free therapy. As the demand for mental health services continues to grow, innovative approaches to providing free therapy are emerging. These approaches leverage new technologies, community resources, and creative funding models to make therapy more accessible to all. Below are some examples of innovative approaches to free therapy. 1. Pay-it-forward model. Some therapy programs have adopted a pay-it-forward model, where clients who can afford to pay for therapy are encouraged to contribute to a fund that supports free therapy for others. This model creates a sustainable way to provide free therapy while also fostering a sense of community and mutual support. For example, some therapy practices offer a sliding scale fee structure, where clients can choose to pay a higher rate if they can afford it. The extra funds collected are then used to subsidize therapy for those who cannot afford to pay. This model has been successful in providing free therapy to a broader population without relying solely on external funding sources. 2. Therapy in non-traditional settings. Another innovative approach to free therapy involves offering services in non-traditional settings, such as libraries, schools, or even public parks. By bringing therapy into the community, these programs reduce barriers to access and reach individuals who might not seek out traditional therapy services. For example, the Books on Prescription program in the UK allows individuals to access self-help books and other mental health resources at their local library, often accompanied by counseling or support group sessions. Similarly, some schools have begun to offer on-site therapy services to students, providing free mental health care in a setting where young people already feel comfortable. 3. Crowdfunding and community support. Crowdfunding has become a popular way to raise funds for free therapy programs. Platforms like GoFundMe and Kickstarter allow individuals and organizations to raise money to provide free therapy services to those in need. These campaigns often rely on the generosity of the community to support individuals who might not otherwise be able to afford therapy. Crowdfunding has been particularly successful in supporting specific populations, such as LGBTQ+ individuals, survivors of trauma, or those living in areas with limited access to mental health services. By tapping into the power of community support, crowdfunding can provide a lifeline to those in need of free therapy. For culturally tailored therapy programs are designed to meet the unique needs of specific populations, such as ethnic minorities, immigrants, or LGBTQ+ individuals. These programs often provide free therapy in a way that is culturally sensitive and responsive to the specific challenges faced by these groups. For example, the National Queer and Trans Therapists of Color Network, NQTTCN, offers free therapy to LGBTQ+ people of color, recognizing the unique intersection of racial and sexual identity in their mental health needs. Similarly, organizations like the Refugee Trauma Initiative provide free, culturally sensitive therapy to refugees and asylum seekers who have experienced trauma. 5. Therapy via text and chat. As mentioned earlier, services like Crisis Text Line have made therapy accessible through text messaging. However, this model is expanding beyond crisis intervention to offer ongoing therapy via text or chat. This approach is particularly appealing to younger generations, who may feel more comfortable communicating via text than in person or over the phone. Therapy via text or chat can also be more accessible for individuals with disabilities, those living in remote areas, or those who have limited access to traditional therapy services. By offering therapy through these accessible formats, providers can reach a broader audience and offer free services to those who need them most. The impact of free therapy on society. The availability of free therapy has a profound impact on individuals, families, and communities. By providing accessible mental health care, free therapy can help to reduce the prevalence of mental health conditions, improve overall well-being, and create more resilient communities. Below are some of the key ways in which free therapy benefits society. 1. Reduced mental health disparities. One of the most significant impacts of free therapy is the reduction of mental health disparities. Low-income individuals, ethnic minorities, and other marginalized groups are often disproportionately affected by mental health conditions, yet they are also the least likely to have access to therapy. By providing free therapy, these disparities can be reduced, ensuring that everyone has the opportunity to receive the mental health care they need. 2. Improved public health outcomes. Free therapy contributes to improved public health outcomes by addressing mental health issues before they become more severe. Early intervention can prevent the development of chronic mental health conditions, reduce the need for hospitalization or emergency care, and improve the overall health and well-being of individuals. In addition to improving mental health, free therapy can also have a positive impact on physical health. For example, individuals who receive therapy for depression or anxiety may be more likely to engage in healthy behaviors, such as exercising, eating well, and avoiding substance abuse. 3. Stronger, more resilient communities. By providing free therapy, communities can become stronger and more resilient. Mental health issues can have a ripple effect, impacting families, workplaces, and entire communities. When individuals have access to the therapy they need, they are better able to cope with challenges, maintain healthy relationships, and contribute to their communities. Free therapy programs often foster a sense of community support, whether through peer support networks, community-based therapy, or public health campaigns. This sense of community can be particularly important for individuals who might otherwise feel isolated or disconnected due to their mental health struggles. For economic benefits. In addition to the health and social benefits, free therapy also has economic benefits. Mental health issues are a significant cause of lost productivity, absenteeism, and disability. By providing free therapy, individuals are more likely to remain productive and engaged in their work and daily lives. Furthermore, free therapy can reduce the economic burden on the healthcare system by preventing the need for more intensive and expensive treatments. Early intervention and ongoing support can help individuals manage their mental health conditions more effectively, reducing the need for hospitalization, emergency care, or long-term disability. 5. Promotion of mental health awareness. Free therapy programs often go hand in hand with efforts to raise awareness about mental health. By making therapy more accessible, these programs help to normalize the conversation around mental health, reduce stigma, and encourage more people to seek help when they need it. Public health campaigns, community outreach, and media coverage of free therapy programs can all contribute to a greater understanding of mental health issues and the importance of seeking care. As awareness increases, so too does the likelihood that individuals will seek out the support they need before their mental health issues become more severe. The future of free therapy. As the demand for mental health services continues to grow, the future of free therapy will likely involve a combination of traditional and innovative approaches. While there are still many challenges to overcome, there is also a growing recognition of the importance of making therapy accessible to all. Below are some trends and possibilities for the future of free therapy. 1. Expansion of digital and telehealth services. The expansion of digital and telehealth services is likely to continue, making therapy more accessible to individuals who may not have access to traditional in-person therapy. As technology continues to evolve, these services will become more sophisticated, offering more personalized and effective mental health care. There is also potential for the integration of artificial intelligence, AI, and machine learning into therapy services, providing real-time support and insights based on individual needs. However, it will be important to ensure that these technologies are used ethically and that they complement, rather than replace, human therapists. 2. Greater integration of mental health into primary care. The integration of mental health services into primary care settings is another trend that could improve access to free therapy. By offering mental health services alongside physical health care, individuals can receive more comprehensive and holistic care. This approach could also help to reduce the stigma associated with seeking mental health care, as individuals would be able to access therapy in a familiar and non-stigmatizing environment. Primary care providers could play a key role in identifying mental health issues early and connecting patients with the appropriate therapy services. 3. Increased funding and policy support. As awareness of the importance of mental health continues to grow, there is likely to be increased funding and policy support for free therapy programs. Governments and nonprofit organizations may invest more resources in expanding access to therapy, particularly for underserved populations. Advocacy efforts will also be crucial in ensuring that mental health remains a priority on the policy agenda. By continuing to raise awareness of the need for accessible mental health care, advocates can help to secure the funding and policy changes necessary to support free therapy programs. 4. Community-led mental health initiatives. Community-led mental health initiatives are likely to play an increasingly important role in providing free therapy. These initiatives often involve grassroots efforts to address mental health needs within a specific community, drawing on local resources and knowledge. Community-led initiatives can be particularly effective in reaching marginalized populations and providing culturally tailored therapy services. By empowering communities to take charge of their mental health, these initiatives can create more sustainable and effective solutions. 5. Collaboration between public and private sectors. Collaboration between the public and private sectors could also be a key factor in the future of free therapy. By working together, governments, nonprofits, and private companies can pool resources and expertise to expand access to therapy. For example, private companies could partner with nonprofits to provide free therapy services to their employees or donate to community mental health programs. Similarly, governments could offer incentives for private companies to invest in mental health initiatives. Conclusion: free therapy is an essential component of a healthy and equitable society. By making mental health care accessible to all, regardless of financial circumstances, free therapy can improve individual well-being, strengthen communities, and contribute to better public health outcomes. While there are many challenges to providing free therapy, including funding limitations, stigma, and disparities in access, there are also numerous opportunities to expand and improve these services. By leveraging technology, fostering community support, and advocating for policy changes, we can work towards a future where everyone has access to the mental health care they need. As we continue to navigate the complexities of mental health care, it is crucial to recognize the value of free therapy and to support the programs and initiatives that make it possible. Whether through government funding, nonprofit efforts, or innovative approaches, free therapy has the potential to transform lives and create a more just and compassionate society. If you enjoyed this video, don't forget to hit that subscribe button and join the Ni655 family. Give us a thumbs up if you liked the content, and make sure to click the bell icon so you never miss an update. Thanks for watching, and stay tuned for more awesome videos.